Hello, everyone, and welcome to this week's What's Up Wednesday, where we are going live with you every Wednesday at 12 p.m. Eastern Time on Facebook and LinkedIn to talk about our upcoming 21st Annual International Human Trafficking and Social Justice Conference, hosted virtually on September 18th through the 20th. We are officially 4 weeks away from the conference today. It is coming up so quickly, very excited. Thank you for joining us today. My name is Anna Schramm, and I am the International Conference Planner working at the University of Toledo's Human Trafficking and Social Justice Institute. And today we have a special guest with us. Mindy Lawsey is the Forensic Nursing Program Manager at St. Vincent Medical Center here in Toledo, Ohio. She works to serve the medical and legal needs of persons who have experienced violence. So hi, Mindy. Thank you so much for joining us today.
Hello, everybody.
Thank you. So today we are focusing on our healthcare related presentations at the conference. Over the past month or so, if you've been joining us on these weekly Wednesdays, we have been talking about how we are a very diverse conference and there are a lot of topics that you can choose from. One of those topics that you can learn about at the conference is our healthcare sessions and how that relates to anti-trafficking and the social justice field. So before we get into that too much, Mindy, can you start us off by telling us a little bit about yourself and the work that you do?
Yes, absolutely. Hello again, everybody. It is so exciting to see engagement surrounding the conference. Again, my name is Mindy Lawsey. I am the Forensic Nursing Program Manager at St. Vincent Medical Center in Toledo, Ohio. A lot of the times when I refer to forensic nursing, a lot of people are curious about what type of nursing that is. And so to provide some insight, forensic nursing is an integration of nursing, science, and the legal system. Forensic nurses are a specialized group of nurses who provide holistic nursing care to victims of violence. Directly or at the bedside, forensic nurses offer detailed medical forensic exams, which include both a medical and assault history, injury identification and documentation, medical forensic photography, and the preservation and collection of evidence. Forensic nurses also maintain the chain of custody as well as providing safety planning and referrals to community partners. Indirectly or beyond the bedside, forensic nursing serves as they serve as expert consultants. They collaborate with healthcare teams to address the unique needs of those who have experienced a medical and legal issue while managing community resources and transitions of care. Forensic nurses play a key role in identifying someone who may be experiencing violence, collecting information surrounding how this violence intersects with their medical needs, and preserving evidentiary materials that may be lost otherwise during the patient's hospital visit. Forensic nurses are specifically trained to provide holistic and trauma responsive care to the patient who has experienced sexual violence, intimate partner violence, neglect, and or physical assault. This includes vulnerable patient populations such as the developmentally disabled, the children, and elderly patients. In addition to all of this, we are called upon by our law enforcement partners to provide testimony in the court of law as a fact or expert witness.
Wow. Thank you, Mindy. I think I learned something new. I don't actually think I knew what forensic nurse examiners did. So thank you for explaining that. That's a lot that you do. And I feel like that's really important for patients who are coming into the healthcare system, that you help them navigate all of those areas. So kind of along those lines, so can you tell our listeners about, this is a little bit of a double question, but tell our listeners about the need for and the importance of healthcare workers working in the anti-trafficking and social justice fields, and why we even need to be talking about these topics at a conference.
Yeah, that is two really great questions. To kind of respond to both of them, violence is a healthcare issue, and therefore human trafficking is a healthcare issue.
Mm-hmm.
Trafficked persons can appear to be elusive to the healthcare provider. And what I mean by that is they often look like you or I. They present with chief complaints as simple as dental pain or ear infections, ranging to something as serious as a trauma alert, a sexual assault, non-fatal strangulation, and or drug overdose. When considering how to treat violence as a differential diagnosis, it's important to understand the signs and symptoms that may accompany a trafficked person, those red flags that are often referred to. Specifically in a hospital or urgent care setting, they may present one time to manage their acute medical issue with little to no follow up. This is a perfect opportunity to identify, intervene, and inform the person of options that are available, all the while respecting the dignity of the human person.
Mhm.
This is a unique opportunity afforded to the healthcare provider. Therefore, it is essential for the healthcare provider to understand the complex needs of a trafficked person and what best practice looks like. This can all be learned through healthcare topics provided at the conference.
Awesome. Yeah. And I think I learned it was either at the conference or from Dr. Celia Williamson, who founded the conference, how integral healthcare workers are in identifying victims who come into healthcare settings and in a unique position. So it is really important for healthcare workers to learn the red flags, learn the signs, be involved, because they are in a more unique position maybe than law enforcement or social workers, who there might be a little bit of stigma when working with them, but I feel like healthcare is a little bit more of that neutral playing ground so I just really applaud the work that you do and that you're bringing these topics to the conference. And you have been involved in the conference for several years now, either as an attendee, you volunteered many times, and also as a presenter. So tell us a little bit about your experience with the conference and why you keep coming back.
Oh man, absolutely. This conference is the oldest and largest conference in the world with representation from 57 countries and all 50 states.
Yes.
There is so much information, so much diversity, and so many people to build relationships with. I always walk away with more information than I came with, feeling informed and inspired. It's one of my favorites every year.
Well, we're glad that you keep coming back and that you're able to continue to make connections and learn new things. And you are actually presenting at this year's virtual conference. Your session is titled Human Trafficking, a Healthcare Systems Approach to Trauma-Informed Care. So I know you're presenting with some other healthcare workers. I know your team is going to be presenting a lot of great information in that session. But for people who are listening, can you give just a little brief overview or a couple little things to make them want to learn more about it?
Yeah, it'd be my pleasure. I have the pleasure actually of working beside a trauma recovery team and also a forensic nursing community of practice that serves that serves victims of violence across many states, meaning we have campuses in Kentucky, we have campuses in Virginia, and obviously, of course, Ohio. And so we're able to collaborate with these individuals based upon what they're seeing and kind of stand in solidarity about how we should be approaching this issue as a healthcare system. So our presentation explores what trauma-informed care actually looks like to those being trafficked. What should we say? How do we say it? And how do we relay this concern to each other as we're addressing it in real time while still focusing on the medical needs of the patient themselves? It discusses a healthcare systems approach to the holistic needs of care for those that are being trafficked. So beyond the medical needs, that we know that these individuals have complex needs, and how do we work together to get those resolved? And then we also discuss a little bit about the role of forensic nurses and the Trauma Recovery Center through some case reviews. Case reviews are my favorite just because they kind of offer that real-time insight about what we're seeing, how we're seeing it, and how we responded to it. Also provides many opportunities for improvement in terms of the care that we provide. So those case reviews, we kind of go through those a little bit just to kind of show you exactly what we do and how we do it. And then we also, towards the end, discuss community partnerships and how their respective role contributes to the overall success beyond the bedside.
Yeah, that's going to be a great session. I love that you're going to give case examples. I think that helps bring it into like people's minds better. You know that this is actually happening. It's real world examples. I love that you are working in this program's working in different states as well. So that collaboration and working with communities, having a multidisciplinary team, that it's not just the healthcare workers that are going to be working, but after they leave the healthcare system, what then? So it's going to be a great session. So if you listeners want to hear more from Mindy and her team that's going to be presenting on this, make sure you are registered for our conference. Our website is traffickingconference.com/register. You only have a couple more weeks to register before registration cuts off before the conference. So make sure you go to our website and check it out. I am going to highlight a couple of our other healthcare related presentations that you can attend at the conference. Remember, you have over 100 sessions that you can choose from. So this is just a couple that I'm going to be listing, as it would be overwhelming. But if you are registered to attend the conference, remember that you do have access to watch all of the recordings afterwards for up to 3 weeks. So it's a lot of sessions, a lot to choose from. You might be going back and forth on which ones you want to attend live. So it's nice to know that you can go back and watch presentations that you missed if you have meetings during the day. So make sure that you are registered so you don't miss out on that as well. So a couple of the ones that I do want to mention are Wendy Goldsmith, Ora Burdett, and Dr. Taryn Taylor will be presenting on education and research with the health sector, the CARES model for human trafficking education. Next, Dr. Kristen Sabla will be talking about overcoming the trauma triangle using a neurobiologic approach. Chelsea Padilla will be providing an introduction of advocating opportunities nurse advocate program. And then Nani Quadrado will be presenting on healthcare utilization by labor trafficked persons. So I love this variety of healthcare presentations just within this small little healthcare sector of the conference, that there are going to be a lot of different topics within the healthcare field. So if you want to learn more about those healthcare sessions and read about all of our other sessions at the conference, we have our full schedule on our website, traffickingconference.com/schedule. So you can already go on there, read about the presentations, read about the presenters, see which ones you want to attend. And then you can learn about the healthcare ones and then all of the other variety of topics that we have. So before we wrap up today, Mindy, do you have anything else that you would like to add?
I'd love to add that if you are a healthcare provider and you encounter or suspect a trafficked person that you are caring for, slow down, move at the pace of the individual that you are assisting. If forensic nursing is available, consult a forensic nurse. But most importantly, educate and inform yourself. This conference is a great opportunity, and I'm really hopeful and excited to see all of you there.
Awesome. Well, thank you, Mindy. And I think that's such an important note to leave off of. And we get distracted by everything in our daily lives, but remembering to slow down, meet the person where they are at, and really find out what their needs are so we can best serve them, because that is why we do the work that we do. So thank you for joining me today on this What's Up Wednesday. Thank you for bringing your expertise and knowledge and always coming back to the conference. As mentioned, we do go live on Facebook and LinkedIn every Wednesday at 12 p.m. Eastern time. Over the next couple weeks, we're going to continue to talk about the variety of topics and presentations that you can learn about in these next couple weeks before the conference. Next week, we are going to have a special guest, Rita O'Brien, on with us, and we're going to be focusing on our lived experience presentations at the conference. So if you have any questions, if you want to learn more about anything we talked about or anything else related to our conference, please go to our website, traffickingconference.com. So we look forward to seeing you back here next week. Thank you again for joining us today, and everybody have a great rest of your day. Bye.